What are the primary modes of transmission for infections in a healthcare setting, and how can healthcare professionals implement effective measures to break the chain of infection? Answer: the primary modes of transmission include direct transmission occurs when an infected person transfers pathogens directly to another person, e.g., touching, kissing. Indirect transmission involves transfer via contaminated objects or surfaces, fomites, e.g., doorknobs, medical instruments. Airborne transmission: pathogens can be carried in the air and inhaled, e.g., tuberculosis. Droplet transmission involves respiratory droplets from a cough or sneeze that travel short distances, e.g., influenza. To break the chain of infection, healthcare professionals can implement standard precautions, always treat all blood and bodily fluids as potentially infectious, employ transmission-based precautions. Depending on the mode of transmission, use airborne, droplet, or contact precautions. For example, using an air mask for airborne precautions and gloves and gowns for contact precautions. Practice hand hygiene, regular and thorough hand washing with soap and water or alcohol-based hand sanitizers before and after patient contact. What are the critical steps involved in providing perineal care to a female patient, and why is this procedure essential for preventing infections? Answer: to perform perineal care for a female patient, follow these steps. Preparation: gather necessary supplies: soap, warm water, clean washcloths, gloves, towels, and a waterproof pad. Explain the procedure to the patient to ensure comfort and privacy. Hand hygiene: wash your hands thoroughly before and after the procedure. Positioning: position the patient comfortably, typically lying on their back with legs slightly apart, and place a waterproof pad under them. Glove use: put on gloves to maintain hygiene. Washing: start from the pubic area and wash from front to back to prevent introducing bacteria into the urinary tract. Use a clean section of the washcloth for each wipe and rinse thoroughly. Drying: pat the area dry with a towel, again moving from front to back. Disposal and cleaning: dispose of used materials properly and remove gloves, followed by hand hygiene. Importance: perineal care is essential in preventing urinary tract infections, UTIs, and skin breakdown by maintaining cleanliness and reducing bacteria in sensitive areas. The Centers for Disease Control and Prevention (CDC) emphasizes the importance of hygiene practices to minimize the risk of infection. Explain how to assist a bedridden patient with dressing, considering both safety and comfort. Answer: when assisting a bedridden patient with dressing, it is essential to ensure their safety and comfort through the following steps. Assessment: evaluate the patient's mobility, preferences, and any medical conditions that may affect dressing. Preparation: choose clothing that is appropriate for the patient's size, weather, and preferences. Lay out clothing in an accessible manner. Safety: ensure the bed is at a comfortable height to reduce strain on both the patient and caregiver. Use a gait belt if necessary to assist with positioning. Assisting with undressing: start by helping the patient remove any upper clothing. Assist them by lifting gently from the shoulders and guiding the sleeves off. For low clothing, roll the patient gently to one side to remove the garment and then assist them back dressing. For the upper body, assist the patient to raise their arms while you guide the clothing over their head. Ensure the shirt is pulled down properly. For the lower body, use a similar technique. Have the patient lift their legs slightly while you guide the pants or gown into place. Comfort check: ask the patient if they are comfortable and adjust clothing as needed. Final assessment: ensure the clothing is not twisted or bunched up, which could cause discomfort or pressure sores. Following the guidelines from the National Institutes of Health regarding patient care promotes dignity and enhances the overall experience of the patient during dressing. Mr. Johnson, a 75-year-old patient recovering from hip surgery, needs assistance with bathing. He expresses concern about slipping and feels embarrassed about needing help. How should you approach this situation? Answer: when assisting Mr. Johnson with bathing, consider the following approach. Building rapport: start by acknowledging his feelings of embarrassment. Reassure him that needing assistance is normal, especially after surgery. Explaining the process: explain the bathing procedure step by step, emphasizing safety measures to alleviate his concerns about slipping. Use terms like support and care to build comfort. Safety precautions: ensure the bathroom is equipped with safety features such as non-slip mats, grab bars, and a shower chair if needed. Ensure that the water temperature is comfortable before he enters. Offering choices: allow Mr. Johnson to participate in the process by offering choices, such as whether he prefers a shower or a bath, or what time he would like to bathe. Maintaining privacy: use curtains or towels to provide privacy during the bathing process. Assisting with bathing: if he chooses a shower, offer to stand nearby to provide support without being intrusive. If he is uncomfortable standing, assist him in sitting on a shower chair while you wash, encouraging independence. Encourage Mr. Johnson to wash areas he feels comfortable reaching to promote his independence. Follow up. After bathing, ensure he feels warm and comfortable and provide assistance in dressing if needed. Following the American Association of Colleges of Nursing (OCON) guidelines for providing patient-centered care helps build trust and improves patient outcomes. Describe the importance of monitoring input and output (IO) for patients and the key components involved in accurate measurement. Answer: monitoring input and output (IO) is vital for assessing a patient's fluid balance and overall health. It helps in identifying potential issues such as dehydration or fluid overload. Here's how to accurately measure IO. Definition: input refers to all fluids consumed, including oral intake, IV fluids, and any fluids administered via feeding tubes. Output includes all fluids eliminated, including urine, stool, vomit, and drainage from wounds or other devices. Components of measurement: input, measure all oral intake, drinks, soups, and ice chips, considering 1 cup of equals 1/2 cup of fluid. Record IV fluid intake accurately by noting the type and amount administered. Output, measure urine output using calibrated containers. Each time a patient voids, document the volume. For feces, estimate the volume and note the consistency. Document any other outputs like wound drainage and ensure to note the time and characteristics of the output. Clinical significance: changes in IO can indicate potential complications. For example, increased output may signal diabetes or excessive fluid intake. Decreased output could indicate kidney issues or dehydration. By adhering to the guidelines from the Joint Commission on Accreditation of Healthcare Organizations, JCAHO, CNS can help ensure early detection and management of potential complications. What strategies can be employed to prevent pressure sores in patients who are bedridden or have limited mobility? Answer: preventing pressure sores or bed sores is crucial for patients with limited mobility. Here are effective strategies. Regular repositioning. Reposition the patient at least every 2 hours to relieve pressure on vulnerable areas like the heels, sacrum, and shoulders. Use of support surfaces. Utilize pressure-relieving mattresses or cushions that distribute weight evenly and reduce pressure on specific points. Skincare. Conduct regular skin assessments to identify any signs of redness or breakdown. Use moisturizing creams to keep the skin hydrated. Nutrition. Ensure adequate nutrition and hydration to promote skin health. Proteins, vitamins, and minerals are vital for skin integrity. Education. Educate patients and caregivers about the importance of mobility and how to minimize pressure on susceptible areas. Monitoring. Keep detailed records of skin assessments and any interventions to identify trends and adjust care plans accordingly. According to the National Pressure Ulcer Advisory Panel (NPUO), these interventions are essential in maintaining skin integrity and preventing the development of pressure sores. Explain the proper technique for emptying a urinary drainage bag, including the rationale behind each step. Answer: emptying a urinary drainage bag must be done with care to prevent infection and maintain hygiene. Follow these steps. Preparation. Gather supplies: gloves, a clean container for measuring urine, alcohol wipes, and the trash bag for disposal. Hand hygiene. Wash your hands thoroughly before beginning. Glove use. Put on clean gloves to maintain a sterile environment. Positioning the bag. Position the drainage bag below the level of the bladder to prevent backflow of urine. Emptying the bag. Remove the drainage spout cap without touching it to avoid contamination. Allow urine to drain into the measuring container without touching the container to the spout. If measuring, ensure to note the volume. Cleaning the spout. Wipe the spout with an alcohol wipe before closing it to prevent bacteria from entering the bag. Disposal. Dispose of the urine properly and discard gloves after use, followed by hand hygiene. Documentation. Document the output in the patient's record accurately, including any abnormalities observed in the urine. Following these steps aligns with infection control protocols outlined by the CDC and helps ensure patient safety. How can you effectively assist a patient with oral care, particularly for those who are unconscious or have difficulty swallowing? Answer: assisting with oral care for patients who are unconscious or have swallowing difficulties requires careful consideration to ensure safety and hygiene. Here's how to do it effectively. Preparation. Gather necessary supplies: toothbrush, toothpaste, suction device, soft cloths, and water. Assessing the patient. Evaluate the patient's level of consciousness and swallowing ability before proceeding. Positioning. For unconscious patients, position them on their side to reduce the risk of aspiration. Use pillows for support. Oral hygiene. Use a soft toothbrush and toothpaste to gently brush the teeth. If the patient is unable to cooperate, use moistened swabs or a soft cloth to clean the teeth and gums. Moistening the mouth. Use water or an oral moisturizing solution to keep the mouth hydrated. Be cautious not to give water directly to those who cannot swallow. Suctioning. If the patient has excess secretions, use a suction device to clear the mouth gently. Follow appropriate suctioning techniques to avoid trauma. Discuss the importance of skin care in the prevention of pressure sores and the techniques used to identify at-risk patients. Answer: skin care plays a critical role in preventing pressure sores, particularly for immobile or bedridden patients. Here's a detailed look at its importance and techniques for identifying at-risk individuals. Importance of skin care. Healthy skin is the first line of defense against infection. Maintaining skin integrity reduces the risk of pressure sores, which can lead to complications like infections and prolonged hospitalization. Identifying at-risk patients. Conduct a thorough assessment using tools such as the Braden scale, which evaluates factors like sensory perception, moisture, activity, mobility, nutrition, and friction shear. Patients scoring lower are at higher risk. Regular skin assessments. Perform daily skin checks focusing on pressure points e.g. heels, sacrum, to identify early signs of redness or breakdown. Moisture management. Keep the skin clean and dry. Use barrier creams to protect the skin from moisture due to incontinence or sweating. Patient education. Educate patients and caregivers about the importance of skin care, regular repositioning, and recognizing early warning signs of pressure sores. Utilization of equipment. Employ specialized mattresses and cushions to relieve pressure and enhance comfort. Documentation. Keep accurate records of skin assessments, care provided, and patient education efforts. This aligns with the guidelines from the National Pressure Ulcer Advisory Panel (NPUAP). By implementing these strategies, healthcare providers can significantly reduce the incidence of pressure sores and improve patient outcomes. How do you assist a patient with bowel and bladder retraining, and what are the key considerations to ensure the process is effective? Answer: assisting a patient with bowel and bladder retraining involves a structured approach aimed at restoring control over elimination functions. Here are the steps and key considerations. Assessment. Evaluate the patient's current elimination patterns, including frequency, consistency, and any relevant medical history. Establishing a schedule. Develop a toileting schedule based on the patient's typical elimination patterns. Aim for regular intervals, e.g. every 2-4 hours, to encourage routine. Patient education. Educate the patient on the importance of the retraining process. Discuss dietary modifications to promote regular bowel movements, such as increasing fiber intake and hydration. Creating a comfortable environment. Ensure privacy and comfort during toileting to reduce anxiety and encourage participation. Positive reinforcement. Provide encouragement and positive feedback to the patient to promote motivation and adherence to the plan. Monitoring progress. Keep detailed records of the patient's progress, noting successful voids or bowel movements and any difficulties experienced. What techniques can be used for effective nail and foot care, especially for patients with diabetes? Answer: effective nail and foot care is essential for maintaining the health of patients, particularly those with diabetes, as they are at higher risk for complications. Here's how to provide comprehensive care. Assessment. Conduct a thorough assessment of the patient's feet, checking for any abnormalities such as blisters, redness, swelling, or changes in skin color. Preparation. Gather necessary supplies: nail clippers, files, a basin of warm water, soap, and moisturizing lotion. Soaking. Soak the feet in warm, soapy water for about 10-15 minutes to soften the nails and skin. Nail care. Carefully trim nails straight across to prevent ingrown nails. Avoid cutting nails too short or rounding the corners. Use a nail file to smooth any rough edges. Skin care. Dry the feet thoroughly, especially between the toes. Apply a moisturizer to the top and soles of the feet, but avoid putting lotion between the toes to prevent fungal infections. Monitoring. Encourage patients to inspect their feet daily for any changes or injuries. Provide education on the importance of proper footwear and maintaining foot hygiene. Documentation. Record any observations related to the patient's foot health and nail care during routine assessments. Note any changes that may require further evaluation. Guidelines. Follow the American Diabetes Association (ADA) guidelines for foot care, which emphasize regular assessments and education to prevent complications like infections or ulcers. By implementing these techniques, healthcare providers can significantly reduce the risk of foot-related complications in patients with diabetes. What is the importance of hand hygiene in infection control, and what are the recommended techniques for effective hand washing? Answer: hand hygiene is crucial in infection control as it prevents the transmission of pathogens that can lead to healthcare-associated infections. HIES, the Centers for Disease Control and Prevention (CDC), emphasizes the following techniques for effective hand washing: use of soap and water. Wet hands with clean running water, warm or cold. Apply soap and lather by rubbing hands together. Scrub all surfaces, including back of hands, between fingers and under nails for at least 20 seconds. Rinse hands under clean running water. Dry hands using a clean towel or air dry. Use of alcohol-based hand sanitizers. Apply the product to the palm of one hand. Rub hands together, covering all surfaces until hands feel dry, approximately 20 seconds. What are the standard procedures for measuring vital signs in a clinical setting, and what factors can influence the readings? Answer: measuring vital signs involves obtaining a patient's blood pressure, pulse, respiratory rate, and temperature. Standard procedures include blood pressure. Position the patient comfortably, ensuring the arm is at heart level. Use a calibrated sphygmomanometer and stethoscope. Inflate the cuff and gradually deflate while listening for the Korokov sounds. Pulse. Locate the radial or carotid pulse. Count the beats for 30 seconds and multiply by 2, noting rhythm and quality. Respiratory rate. Observe the patient's chest rise and fall for 1 minute. Temperature. Use appropriate methods, oral, rectal, tympanic, or axillary, based on patient condition and preference. Factors influencing these readings include the patient's age, activity level, medication, time of day, and emotional state, which must be considered for accurate assessment. Mr. Thompson is a 75-year-old patient who is recovering from hip surgery. He requires assistance with ambulation and is anxious about falling. What strategies should the CNA implement to ensure Mr. Thompson's safety during ambulation? Answer: to ensure Mr. Thompson's safety during ambulation, the CNA should implement the following strategies: assess patient mobility, evaluate Mr. Thompson's strength, balance, and any pain levels that may affect his ability to walk. Use of assistive devices. Depending on his mobility needs, provide a walker or cane to enhance stability. Safety precautions. Clear the environment of potential hazards, e.g. loose rugs, clutter. Encourage Mr. Thompson to wear non-slip footwear. Gait training. Instruct him on proper gait techniques using the assistive device. Walk alongside him, providing support if he appears unsteady. Encouragement and reassurance. Offer verbal encouragement and reassurance to help reduce his anxiety about falling. Explain the significance of isolation precautions in infection control and outline the types of precautions used. Answer: isolation precautions are essential in infection control to prevent the spread of infections within healthcare settings, particularly for patients with known or suspected contagious diseases. The CDC recommends several types of precautions. Standard precautions apply to all patients, regardless of infection status. This includes hand hygiene, the use of PPE when exposure to blood or body fluids is possible, and safe handling of sharps. Contact precautions used for infections spread by direct or indirect contact. Healthcare workers must wear gloves and gowns when interacting with the patient or their environment. Droplet precautions required for pathogens transmitted through respiratory droplets, e.g. influenza. Masks should be worn when within 3 feet of the patient. Airborne precautions necessary for diseases transmitted through airborne particles, e.g. tuberculosis. Negative pressure rooms and air respirators are essential. Understanding these precautions is vital for a CNA to protect both themselves and their patients from potential infections. What are the key steps in transferring a patient safely from a bed to a wheelchair? Answer: transferring a patient safely requires careful planning and execution to prevent injury. Key steps include: prepare the environment, ensure the wheelchair is positioned close to the bed with the brakes locked, remove any obstacles in the path, assess patient condition, check the patient's ability to assist with the transfer and explain the procedure to reduce anxiety, use of proper body mechanics, stand close to the patient, bend at the knees and keep the back straight to maintain balance and avoid injury, position the patient, assist the patient to sit on the edge of the bed and encourage them to place their feet flat on the floor, secure hand placement, provide assistance using a gait belt or by supporting their upper arms, execute the transfer on the count of 3, pivot and assist the patient into the wheelchair. Adjust the patient's position. Ensure the patient is comfortable and secure in the wheelchair. Discuss the implications of not following infection control guidelines in healthcare settings. What could be the potential consequences? Answer: failing to adhere to infection control guidelines can have severe implications for patient safety in healthcare operations, including increased healthcare-associated infections, HIES, Non-compliance can lead to a higher incidence of highs, which may prolong hospital stays and increase healthcare costs. Legal ramifications. Facilities may face lawsuits due to negligence if patients acquire infections that could have been prevented. Reputation damage. A healthcare facility's reputation may suffer, leading to loss of trust from patients and the community. Financial impact. Increased costs due to additional treatments, extended hospitalizations, and potential penalties from regulatory bodies for failing to maintain infection control standards. Understanding these implications emphasizes the necessity of rigorous infection control practices in healthcare settings. Ms. Garcia is a 60-year-old patient with limited mobility. As a CNA, you are tasked with assisting her with range of motion (ROM) exercises. What specific techniques should you use and what precautions should be taken to prevent injury? Answer: when assisting Ms. Garcia with ROM exercises, the CNA should employ the following techniques and precautions. Types of ROM exercises. Active ROM. Encourage Ms. Garcia to perform movements independently to enhance joint mobility. Passive ROM. If she cannot move her joints, the CNA should gently assist in moving her limbs through their full range of motion. Demonstrating techniques. Show the patient how to perform each exercise to promote understanding and participation. Precautions. Ensure the patient is comfortable and supported during exercises. Avoid any movements that cause pain or discomfort. Monitor vital signs before, during, and after exercises to detect any adverse reactions. Frequency and duration. Follow a schedule for ROM exercises, generally 2-3 times a day for each joint, ensuring a balance between activity and rest. What are the key considerations for a CNA when assisting a patient with personal hygiene? Answer: when assisting a patient with personal hygiene, the CNA must consider the following key factors. Patient dignity and privacy. Always ensure the patient's privacy by using screens or curtains and informing them about what to expect during the procedure. Safety measures. Use proper body mechanics and consider the patient's mobility to prevent falls. Have all necessary supplies within reach before beginning. Cultural sensitivity. Be aware of the patient's cultural beliefs and preferences related to personal hygiene practices. Assessment of skin integrity. Monitor for any skin issues such as rashes or sores and report findings to nursing staff for further evaluation. Encouraging independence. Encourage patients to perform as much of their personal hygiene as possible to promote autonomy and self-esteem. By considering these factors, the CNA can provide respectful and effective personal hygiene assistance. How should a CNA document a patient's vital signs, and what specific information is necessary to include in the medical record? Answer: documentation of a patient's vital signs is critical for effective communication and care continuity. A CNA should include the following information in the medical record. Date and time. Record the exact date and time when vital signs were taken. Measurements. Include the specific values for blood pressure, e.g. systolic diastolic heart rate, beats per minute, respiratory rate, breaths per minute, and temperature. Specify the method used. Patient position. Note the patient's position, e.g. sitting, lying down during the measurements, as it may affect the readings. Observations. Document any observations related to the patient's condition, such as changes in consciousness, pain level, or any abnormal findings. Initials or signature. Include the CNA's initials or signature to verify the accuracy of the entries. Accurate and thorough documentation is essential for providing quality patient care and facilitating effective communication among healthcare providers. Explain the role of body mechanics in moving, positioning, and transferring patients, and why is it essential for a CNA to use proper techniques? Answer: body mechanics refers to the use of proper posture and movement techniques to prevent injury and ensure patient safety during transfers and positioning. The role of body mechanics includes preventing injuries. Proper techniques help protect the CNA from musculoskeletal injuries caused by lifting or moving patients incorrectly. Patient safety. Using appropriate body mechanics reduces the risk of falls and injuries to patients during transfers, enhancing their overall safety and comfort. Efficiency in care. Employing correct techniques allows CNs to move patients more effectively, conserving energy and reducing fatigue. Key techniques include keeping the load close, maintain the patient's center of gravity close to the body, bending at the knees, use leg muscles rather than the back to lift, pivoting feet, avoid twisting the spine while moving. Explain the legal scope of practice for CNs and the potential consequences of practicing outside this scope. Answer: the legal scope of practice for CNs encompasses tasks such as assisting with daily living activities, bathing, dressing, monitoring and reporting vital signs, providing basic patient care and comfort. Practicing outside this scope, such as performing invasive procedures or administering medications, can result in legal consequences like negligence, failing to provide care according to established standards leading to patient harm, malpractice, legal action taken against a CNA for failing to perform duties competently, resulting in injury or death, license revocation. Regulatory bodies may revoke a CNA's license for serious breaches of practice or ethics. Mrs. Thompson, an elderly patient, has shown signs of severe bruising and has been frequently complaining about pain. As her CNA, you suspect possible abuse. What steps should you take in this situation to address your concerns and ensure her safety? Answer: in this situation, the CNA should document observations, record specific signs, e.g. location and size of bruises, behaviors, and any statements made by Mrs. Thompson about her situation. Do not confront the suspected abuser. Avoid discussing your suspicions directly with any suspected individual, as this may endanger the patient further. Report to a supervisor. Immediately inform your supervisor or the designated authority within the healthcare facility. Reporting is mandatory under state laws regarding abuse. Follow facility protocols. Adhere to established protocols for reporting abuse, including filling out any necessary forms or documentation. Provide ongoing support. Continue to care for Mrs. Thompson and ensure she feels safe and supported during this time. What are the standard and transmission-based precautions a CNA must implement to minimize the risk of infection, and how do they differ? Answer: standard precautions are the basic infection control measures used at all times, which include hand hygiene, use of personal protective equipment (PPE) when exposure to blood or bodily fluids is anticipated, safe handling and disposal of sharps. Transmission-based precautions are applied when dealing with specific infections and are categorized as airborne precautions and respirators for infections like tuberculosis, droplet precautions, surgical masks when within 3 feet of the patient for conditions like influenza, contact precautions, gloves and gowns when interacting with patients infected by pathogens that can be spread through direct or indirect contact, e.g. MRSA. Discuss the implications of negligence in the role of a CNA and provide examples of how it can manifest in daily patient care. Answer: negligence occurs when a CNA fails to provide care that meets the standard expected in their profession, resulting in harm to a patient. Implications of negligence include legal liability for damages caused by the injury, possible disciplinary action by regulatory boards, loss of job or reputation within the healthcare field. Examples include failing to report changes in a patient's condition, e.g. elevated blood pressure to a nurse or physician, not providing assistance with ambulation leading to a fall and injury, neglecting proper hygiene practices resulting in a healthcare-associated infection. Explain the chain of infection and identify key interventions that CNs can use to break this chain. Answer: the chain of infection consists of 6 components. Infectious agent, the pathogen causing infection, bacteria, virus. Reservoir, the natural habitat of the pathogen, humans, animals. Surfaces, portal of exit, the path by which the pathogen leaves the reservoir. Blood, secretions, mode of transmission, how the pathogen is transmitted, direct, airborne, droplet, portal of entry, the way the pathogen enters. A new host, skin breaks, mucous membranes, susceptible host, an individual who is at risk of infection. Interventions include proper hand hygiene to prevent the transfer of pathogens, use of PPE to protect against exposure, environmental cleaning to remove pathogens from surfaces. Mr. Jenkins, a resident in a long-term care facility, has not been eating properly and has lost significant weight over the last month. As a CNA, what steps should you take to address his nutritional needs and ensure proper reporting? Answer: to address Mr. Jenkins' nutritional needs, assess and document, monitor his food intake, weight, and any reported symptoms, e.g. nausea, difficulty swallowing. Encourage nutrition. Offer small, frequent meals and snacks that cater to his preferences. Ensure he has assistance if needed during mealtime. Communicate with the healthcare team. Report your observations and concerns to the supervising nurse to initiate further assessment by a dietitian or physician. Follow care plans. Implement any dietary interventions recommended by the healthcare team, ensuring to document the outcome and any changes in condition. What are the mandatory reporting requirements for CNs regarding abuse, and what constitutes reasonable suspicion in these cases? Answer: CNs are legally obligated to report suspected abuse or neglect to appropriate authorities. Mandatory reporting requires CNs to notify their supervisor or designated agency upon observing signs of physical abuse, G. Unexplained injuries, bruises, signs of emotional or psychological abuse. E. G. Withdrawal, fearfulness, neglect indicators. E. G. Poor hygiene, malnutrition. Reasonable suspicion is determined by the consistency of the patient's rapport with observed signs, historical knowledge of the patient's condition and changes over time, professional judgment based on experience and training. How do isolation procedures differ for airborne, droplet, and contact precautions, and what specific personal protective equipment (PPE) is required for each? Answer: airborne precautions used for diseases like tuberculosis and chickenpox. PPE required N respirator, negative pressure room. Droplet precautions for illnesses such as influenza and pneumonia. PPE required surgical mask when within 3 feet, a protection if there is a risk of splashes. Contact precautions for infections like MRSA or C. difficile. PPE required gloves and gown when entering the patient's room. Isolation procedures. Patients should be placed in appropriate isolation rooms. Negative pressure for airborne. Visitors should be informed of precautions before entering the room. Describe the concept of scope of practice for CN as and how it is enforced to protect both patients and healthcare providers. Answer: the scope of practice defines the tasks and responsibilities CN is legally permitted to perform, which include assisting with daily living activities, monitoring vital signs, reporting changes in patient conditions. Enforcement mechanisms include state regulations. Each state has specific laws outlining CNA responsibilities, which are enforced by licensing boards. Healthcare facility policies. Facilities develop policies based on state laws that guide CNs in their roles, training and certification requirements. Ongoing education ensures that CNs remain knowledgeable about their duties and limitations. Practicing outside the scope can result in legal consequences, including loss of certification, civil liability, and jeopardizing patient safety.